Okay, so let's take a look at this radiograph of the abdomen and pelvis, which is a 35 years old female patient presented with right flank pain, fever, and some elevated white cell count. So what do you see mainly immediately is that there is an increase in gaseous lucency projected over the right sided abdomen. But how would you describe that so that you can make a confirmed diagnosis? What kind of gaseous lucency and where do you think the lucency are located at? Okay, so first of all, we first draw out the boundary of the main lucency here, and you recognize that that really looks like bean-shaped structure, for example, a kidney. But how would you comment that regarding the size of the kidney? Okay, because usual kidney size is around 2 to 3 vertebral levels. For example, let me draw out the normal, so a shadow here. Okay, there are two main things that we'll expect for a kidney on a radiograph. First of all, it is aligning parallel to the lateral border of the psoas major muscle. Secondly, the bipolar renal length is around 2 to 3 vertebral level, just like this. Okay, so if I draw out the normal one, you'll immediately appreciate that this is enlarged, grossly enlarged. Okay, so apart from grossly enlargement, you see that there are some gaseous lucency which are in particularly abundant around the perinephric region, like this. Okay, how about those gas that is within the renal shadow? So let us have a zoom in for further discussion. Why do I need to zoom in? Because if we know that it is emphysematous infection of the kidney, those gas will actually trace along the renal tubules, in which you will see there is some branching like gaseous lucency, or even they will have some linear radiating configurations. Okay, because it is how the nephrons are arranged. Okay, so whenever you have some gas, they will arrange like this, and also may have a little bit branching, and then eventually some gas will penetrate through some necrotic areas of the kidney, and then they will first gather at the perirenal region. Okay, mind you, the retroperitoneal space is not a free space, which is comparing with the intraperitoneal region. So that's why the gas needs to dissect through the fat layer, and then they will gradually diffuse to another region nearby first. Okay, so that's why you will immediately see some gas around the kidney first, and then you see that they are tracking along the psoas major muscle, and then eventually you also see a little bit gas which tracks and then outline the medial aspect of the psoas major muscle, but you do not see any gas which is outlining the lateral border of the left side psoas major muscle. So you can appreciate that, okay, the gas is actually tracking from the right kidney and then all the way out, okay, with least amount of gas which is away from the right-sided retroperitoneum. And then we're going to take a look at also the pelvic region to see whether any emphysematous infection circumscribing the bladder, which you do not see. There is nothing else which is remarkable on the left side, the kidney, expected course of the ureter, etc. Okay, so basically this patient should be suffering from an emphysematous infection involving the right kidney. In the past, it is a very devastating condition which may require debridement, but nowadays the antibiotics regime is actually improving. Sometimes we mainly need some less invasive treatment like drainage, and then try out the course of antibiotics to see whether the patient is doing well. Another thing that you may be required to know in examination is that usually this kind of patient is having some predisposing factor like uncontrolled diabetes mellitus. So that's why you may also try to find out any clues to support that. For example, any very extensive vascular calcifications at the region of the arteries like the aorta, renal arteries, all kinds of branches of the abdominal aorta, and also the eyelid region.